Hello friends, welcome to FastCoder 21 free medical coding YouTube channel. As all of you know, my intention is to share knowledge and gain knowledge. In this session, we are going to learn types of medical coding and salary high to low. So here we are going to know which medical coding specialties are having more salary compared to other specialties. If you want to know what specialty is having the more salary, please watch this session until the end and also like, comment, share and subscribe to our channel if you are visiting for the first time. Usually everyone knows physician coding, but what are included in the physician coding? So in this session, we will learn what are the types of physician coding specialties. So if we see here, we have multiple types of physician coding specialties here. If you take intensivist, allergy, anesthesia, so as anesthesia coding is common in India also, so like pediatric medicine and surgery, this is also common. Burn and trauma is not common in India, but in US we have burn and trauma coding is more familiar with the US medical coders. In India, cardiac catheterization is familiar and cardiology familiar, cardiovascular surgery is familiar, like usually we'll call it as IVR. And we have colorectal surgery. This is complex. So most of the time this colorectal surgery will be performed in the inpatient setting. And we have dermatology, electrophysiology, emergency medicine. So emergency medicine is the common procedural coding system in India, as most of the companies are having emergency medicine. Next, we have endocrinology, family practice, gastroenterology, and general surgery. And also we have neurology, neurosurgery. So these are the very complex coding specialties. So if you are having the exposure on this neurosurgery, you will get more salary compared to the people with other specialties. Like we have obstetrics and gynecology, and we have ophthalmology. Ophthalmology is very famous in UAE. So like they will perform cataract procedures, like strabismus procedures. And we have orthopedics. So orthopedics is evergreen. So if you are having the orthopedics knowledge, we are getting to we are going to get more salary compared to the all other specialties. Here we have otolaryngology, head and neck surgery, pain management, palliative care, pain management, and pathology, surgical and anatomic. Here we have pediatric surgery and physician sorry, physical medicine and plastics and reconstructive surgery, pediatric surgery. So these are the types of surgeries we have. So if you take in physician coding, so for example, if you have anesthesia experience, you will get more salary. So wherever you go, if you are having the CPT surgery knowledge, you can have multiple options. Like if you see here, if you know CPT coding, you can work as anesthesia coder. If you know like CPT coding, you can work as a cardiology coder. You can work as a cardiovascular surgery coder, like colorectal surgery coder. You can work as a dermatology coder. You can work as a endocrinology coder. You can work as a gastroenterology coder. So if you know CPT, you can work as a neurosurgery coder also, and also you can work as a OBGYN coder here. So if you are having the orthopedic along with pain management and neurosurgery, you will get more salary compared to all other specialties. So these are the ASC means ambulatory surgery center specialties. So basically the meaning of this is, so ambulatory surgery specialties will perform all these surgeries like bariatric surgery for obesity, so ENT surgery, general surgery, gastroenterology, neurosurgery, all these types of surgeries are possible using the ASC specialties. So we have hospital coding here again. So we have in hospital coding most of the time we are familiar with inpatient acute care. So here hospital coding we are getting to have more salary compared to all other specialties. And also we have more specialties here like evaluation management coding, SCC audits and ambulance coding. So basically what I would like to tell you is, so in India, if you are a inpatient coder, you will get more salary compared to all other specialties. So if we take one by one, in India, most of the inpatient coders are having more salary. So then surgery specialty coders having the salary, then remaining all other people like ED, HCC, E&M, all other people. So if you want to have more salary, just you need to learn inpatient coding or surgery coding. So basically inpatient coding is that not that much easy. So if you have that dream, you can do. So in order to code as an inpatient coder, you need to have vast experience in ICD-10 CM. So if you are having the more than 3 years experience, no company will take you as an inpatient coder. So if you are having 1 or 2 years experience, you can try as an inpatient coder. So that time also it is very bit difficult. So but you what you can do is just you need to speak with your company and you need to request them that I would like to learn inpatient coding and I want to go ahead with my career. So some companies will accept your proposal and they will provide you with the chance of inpatient coding. So why means inpatient code is having the more salary compared to all other specialties. But the thing is that if you do inpatient coding, you can do only inpatient coding. So if you do CPT surgery coding, you have multiple options here. Like if you see here, so you can work as a bariatric surgery coder, you can work as a ENT coder, you can work as a general surgery coder. So all these specialties are available in the CPT surgery coding. So if you have experience in neurosurgery, so but the requirement is in obstetrics and gynecology. So if you are having the basics of CPT coding, you can work as a OBGYN coding also. But whereas in inpatient coding, so you need to have good understanding of ICD-10 CM and ICD-10 PCS. So but the thing is that inpatient coding is very very complex. It is not possible for the people who are not having the good knowledge of anatomy and physiology. So inpatient coding is very difficult to join. But once if you get the chance in inpatient coding, so you will get the more salary compared to the all other specialties, including surgery, E&M, HCC, and other coding specialties like pathology coding, like all other specialties. But afterwards, if you take after inpatient coding, you are going to have more salaries for surgery coders. Why means if you code as a general surgery coder, you are going to code all 10,000 to 60,000 series. So if you are having 10,000 to 60,000 series, you are having the more values compared to the people who are having only GA specialty or OBGYN specialty or neurosurgery specialty. So if you are having good understanding of anatomy, you can work as a surgery coder, but the difference between inpatient coding and surgery coding is only 2 to 3 lakhs based on your experience. But afterwards, we have other specialties like E&M, HCC, all those things. The basically the thing is that E&M and HCC, most of the coders will do. If you take in India nowadays, most of the fresher coders are joining in E&M and HCC. The thing is that they have less guidelines in E&M and HCC. Just for example, if in HCC, if you know like 50 to 100 ICD-10 CM codes, you can code very easily. Because of the flexibility, we have less salaries in E&M and SCC coding. So if you want to grow in a medical coding field and if you want to establish your career in medical coding, try to join in inpatient coding or surgery coding. So inpatient coding is evergreen. So if you are having the inpatient coding, you can do any type of coding. So afterwards surgery. So surgery is also more more variants of surgery coding. So if you are having the surgery coding, you can code any type of the jobs are more for surgery coding. Why means if you take here if you are having the experience in ENT, you can work as a pediatric surgery also. But inpatient, if you work as an inpatient, you can work as an inpatient coder only. If you work as a E&M coder, you can work as a E&M coder only. If you work as a SCC coder, you can work as a SCC coder only. So if you want to explore your knowledge and if you want to increase your knowledge, so if you don't have the opportunity and if you did not get a chance to work in the inpatient setting, you can come to the SDS coding. Usually we'll call this surgery coding. So if you want to know more about this surgery coding, please comment in the comment section of this video. I am going to help you whatever it is possible with me. And also please mention in the comment section so which type of specialty you like more and why. So overall I would like to tell you is that inpatient medical coding is having the more salary compared to all other specialties. So after inpatient, we have surgery coding. As we have discussed previously, in surgery coding, we have multiple variants. So job security is also more in the surgery coding compared to inpatient coding. So after inpatient coding, we can compare like ED, E&M, and SCC coding. So these are the most common in India. But in US, we have each and every specialties having the jobs. But in India, as most of the my subscribers are from India, I am planning to go ahead with Indian atmosphere. So this video is useful for USA students also basically. But in USA, you have more opportunities. Like they have specialty codings. For example, if you take rheumatology coding or surgical oncology. So in India, we have more less job opportunities, but in US, we have more job opportunities. So whatever I have mentioned in all these specialty jobs are available in USA. But if you are staying in USA, you can think about these all specialties and to join in the specialty which you like more. So inpatient coding is more salary. Then surgery coding is having the more salary after inpatient coding. Then ED coding is having the third step. Next we have E&M and HCC. So my intention is to educate the people who are likely coming into the medical coding field. So if you have any concern or anything, if you would like to ask me, just to mention in the comment section. And also please like, comment, share and subscribe. So always my intention is to share knowledge, gain knowledge. Thank you friends.